So what causes fibromyalgia syndrome? Well, there are two major types of fibromyalgia syndrome, primary and secondary. Primary fibromyalgia syndrome, there is essentially no initiating factor found. Patients literally just develop this as a problem. This tends to be the minority of patients who present with fibromyalgia syndrome. The other type of fibromyalgia syndrome is so-called secondary fibromyalgia syndrome, and in these cases it's often possible to find an underlying etiology or cause for the fibromyalgia syndrome. In my clinic, some of the commonest causes for fibromyalgia syndrome include trauma, and that may be physical trauma, for example, a road traffic accident, or psychological trauma, either after the accident or due to divorce, bereavement, or some sort of stressful life event. I also see an awful lot of patients who are what we call post-infective, and often if you look back into a patient's history, you will find that they've had some sort of infective illness. Often this will be a viral illness, and they will have a post-viral type of fibromyalgia syndrome. I've also seen it in patients who have bacterial infections, chest infections, and other infections. It is also possible to get fibromyalgia from certain endocrine disturbances, and the commonest one here is patients who have an underactive thyroid, otherwise known as hypothyroidism. And part of the investigations for patients who have fibromyalgia syndrome is to do a full blood count, urea and electrolyte, and always the thyroid function tests to make sure the thyroid is working properly.